Have you ever wondered why so many people say that France is one of the best healthcare systems in the world? If you're an international student, a foreign worker, or someone planning to move to France, understanding how the French healthcare system works can save you both money and stress. In this video, I'll share one of the things that really impressed me about healthcare in France. Its strong focus on prevention rather than just treating diseases after they happen. One of the first things you will hear about when living in France is the Carte Vitale. This small green card is your health insurance card and is used almost every time you visit a doctor, pharmacy, laboratory, or hospital. Instead of paying the full cost of healthcare yourself, the French National Health Insurance, called Assurance Maladie, reimburses a large part of your medical expenses. If you're working in France, your employer will usually provide a complementary health insurance known as a Mutuelle, which often covers the remaining costs. If you qualify for complementary santé solidaire, many healthcare expenses may also be fully covered. One thing I really appreciate is how accessible preventive healthcare is. For example, if you want to get tested for HIV, France has made this much easier than many people expect. You can go to a laboratory and in many cases have an HIV test without needing a doctor's prescription. The test is covered by the French health insurance and there is no upfront payment for eligible people. If you prefer anonymous and completely free testing, you can also visit a CeGIDD, which stands for Centre Gratuit d'Information, de Dépistage et de Diagnostic. These centers specialize in HIV, hepatitis, and sexually transmitted infection prevention, testing, and counseling. They are open to everyone, including people without social security coverage who want anonymous testing. What's even more interesting is that a visit to a CeGIDD isn't just about taking a blood test. Healthcare professionals will often review your health history, answer your questions, discuss prevention, and recommend additional tests if needed. The goal isn't simply to diagnose illness but to help people stay healthy before problems become more serious. Now let's talk about hepatitis B, because this is something many international residents may not know. During a routine blood test, your doctor may request a hepatitis B serology. This blood test doesn't just check whether you have the infection. It also shows whether you're protected against hepatitis B through previous vaccination. If your results show that you are not immune, your doctor or the healthcare professional may recommend getting vaccinated. In France, they will usually write you an ordonnance or medical prescription for the hepatitis B vaccine. With this prescription, you simply go to a pharmacy, present your Carte Vitale, and if you have a company Mutuelle or complementary santé solidaire, much or all of the remaining costs may be covered depending on your health insurance. In some public vaccination centers, recommended vaccinations may also be provided free of charge. The important thing is that France makes preventive vaccination much more accessible than many people expect. Another thing I like about the French healthcare system is that everything is connected electronically. When you present your Carte Vitale, your information is transmitted directly to the health insurance system. This means reimbursements are usually processed automatically. And in many cases, you don't have to complete complicated paperwork. If your Mutuelle is connected electronically as well, the remaining balance is often reimbursed automatically through a process called teletransmission. If you are new to France, I highly recommend creating an account on Amelie.fr. This is the official website of the French health insurance. From there, you can view your reimbursements, download health insurance certificates, update your information, and even communicate with your local health insurance office. It's one of the most useful websites you will use while living in France. Another official resource is the service-public.fr. This website explains many administrative procedures in France, including healthcare rights, social security, and public services. Whenever you are unsure about your healthcare rights or administrative procedures, these two websites should be your first sources of information because they are maintained by the French government. Of course, it's important to understand that not every healthcare service is automatically free. The amount you pay depends on your specific situation, your health insurance rights, and whether you have complementary health insurance. However, compared with many countries, France invests heavily in preventive healthcare because preventing disease is often more effective and less expensive than treating serious illness later. Personally, one of the things I've learned while living in France is that taking care of your health is strongly encouraged. Whether it's getting vaccinated, having regular blood tests, or seeking advice from healthcare professionals, there are many services designed to help people stay healthy. As an international resident, I found it reassuring to know that these preventive services are accessible and supported by the healthcare system. So if you're living in France and you have never checked your vaccination status or considered getting an HIV test, this could be a good opportunity to do so. Speak with your doctor, visit a CeGIDD if appropriate, or check the official information on ameli.fr and service-public.fr. A simple blood test today could help protect your health in the future. I hope this video helped you better understand how preventive healthcare works in France. If you found this information useful, don't forget to share it with your friends, classmates, or colleagues who are also living in France. It might help someone navigate the healthcare system with more confidence. Thanks for watching, and I'll see you in the next video.